Hi, welcome, and thank you for joining us today live or on the recording for episode 34 of Dr. Jeff Talks About Sex and Intimacy, the Healing Path, Acupuncture, and Sexual Health. It means so much to me that you have taken time out of your busy schedule to be with us to learn more about this topic. We are on social media. We're out there on Facebook, on YouTube, on X, LinkedIn, and also on Kick. If you're on X and you have a question, please go to one of the other social media sites and you can put your question in there. If you're a Facebook person, please follow us. The more followers we have, the more we can do with how we're able to provide this video to you on Facebook. Go to the website. If you want to learn more about upcoming episodes, there's a calendar on there that you can pull up and see what's next. You can also go to previous episodes, and we have had some awesome guests, and you can watch previous episodes on the website. We are where you are. Listen to us in your car, when you're working out. We are there on your favorite music streaming service like Spotify, Amazon, iHeartMusic. Listen to us while you're working out. Just want to remind you that all are welcome here. Whatever your sexual orientation, your gender identity, or your relationship style, please know you are welcome in this space to learn, and we are so glad that you tuned in. The goal of the podcast is pretty simple. It's to empower and enlighten you with the scientific, evidence-based information you need to move forward in your journey towards better sexual health and deeper relationships with your loved one. And that helps you live and love more fully. Well, as you're listening, if you're listening live, I am currently in the Northern Rockies connecting with our miraculous, amazing world in a deep way. So today's episode is something special because for the first time in the history of the podcast, it's guest hosted by my dear friend and colleague, Dr. Susan Kellogg-Spadt, an internationally respected expert in pelvic and sexual medicine and a passionate advocate for integrative health. Susan is joined by her guest, Dory Ellen Fish. She's a licensed acupuncturist with decades of experience in Eastern medicine, women's health, and sexual wellness. Together, they're going to explore how acupuncture can support healing from sexual dysfunction, from trauma, pelvic pain, and more. You'll learn how this ancient practice is being used in modern, evidence-informed ways to support not only the body, but the mind and the spirit too. You are in for a real treat with these two experts tonight, and I thank them both for sharing their expertise. Enjoy the episode.
Hi, everyone. I'm Susan Kellogg-Spadt. My guest, Dory Ellen Fish. And thank you, Jeff, from the Rockies. We're really, really psyched to talk about this tonight. And sometimes, Dory, when people think sex, they don't think acupuncture. So why don't you start out by telling us a little bit about what is acupuncture anyway, and how does it dovetail or intersect with the field of sexual medicine?
Okay. Well, acupuncture basically is thousands of year old medicine from like 8 different countries. And it's based on the philosophy of the harmony between yin and yang, which actually is male and female. So just inherently, it's very much about the energetic interplay of those different energies, which are also hormones. There are 12 meridians, so 12 pathways and organs in acupuncture. And one of the 12 is the pericardium, which is also called circulation sex. So right away, they were very aware of sexuality and honored that.
So they knew that somehow blood flow had something to do with sex.
That's right.
And a million, trillion, billion years ago. Okay. So
right.
So acupuncture really has its base in truly the body, the medicine of the body, but it looks at meridians versus just organ systems. Do I have that right?
That's right. So let's say that you're talking about the liver.
Okay.
It would be capital L in our medicine, and it means the pathway that happens to go through the genitals.
Mhm.
And it's also the organ. It's also the emotions that tend to go with that. And it's all those things contained. So each of the 12 system, if each of the 12 meridians and organs, it's all of it together.
Okay. So if somebody's never had acupuncture before, what do you think they should know? I'm scared to death it would hurt. That's what I hear all the time. So does it
Everybody wants to know.
Okay.
I mean, it's not, I've never had anyone not come because it hurts.
Okay.
I mean, there are people who've been afraid, and there are definitely, like, if somebody's very needle sensitive, I mean, there are breathing techniques that we do, but it's really pretty painless.
So is it just like getting one shot in your body?
No, and I think that's what people think, that you're going to go somewhere and you're just going to get jabbed with needles, which really sounds horrific.
Mhm.
It's a prescription, a formula of points that go together that are totally individualized for that person and their condition.
Okay, so it's possible that they would have multiple, not shots, but
Yes.
gentle needle placement in their body. Right?
Yes. Oh, yeah.
How long is the needle in the body?
Then it depends. It depends on the intention. Mm-hmm. So let's say that we're doing a detox for somebody who wants that or needs that because of medications they've been on or whatever. And what that is, there's a prescription of those, and it can be anything from, so if you're doing a detox, the needles are going to be much more superficial, and you're going to do a bunch of them, but they're very light. And I think most people, I have them needle me when they come in. I'll go like, you want to push the needle in? Because most people are very surprised at what these look like. I mean, they really look like a hair. Okay. They're that thin.
Okay.
Yeah.
So my question is this, I've had physical therapy for some muscular disorders, and sometimes the physical therapist has done this thing to me called dry needling. Yes. Is that just the same?
Yeah, it has very little to do with each other. Okay. So dry needling the training is completely different. The license, I don't think you need a license. Like PTs are widely trained in dry needling now, and that can be really effective. It is much more like trigger point injections. So it is, I wouldn't say that that's painless, but it's much more of a body only technique. Like, they don't use the meridians, they use much heavier needles, and it doesn't get into the emotions or spirit of the person. It's more like, okay, your shoulder hurts, these are the trigger points that are efficacious.
So it's really interesting, because what I'm hearing you say is that traditional medicine, we give medicine or we do shots to help the body, and then we go to a psychologist, or counselor to help our mind. And if I'm hearing you correctly, acupuncture works mind-body together during each treatment session. Am I correct?
That is completely correct. And again, it's totally personalized and customized. So part of assessing somebody's situation is how much of it is at what level. So, like, we're talking about sexuality, it could be really very physical, but of course it has emotional aspects, and other people maybe who have faced a lot of trauma, or just because of whatever, it's much more of an emotional and spirit level situation. So it's choosing the points, like on that pericardium heart protector meridian, there are actually points for betrayal of intimacy. And
Okay.
then there are points further down that are much more for the actual meridian and genitals and sexuality. But that's all in the same meridian.
Okay. So let's get nitty gritty. Let's go right into sex med for a little while. One
Right.
of the most common things that I hear in my practice is complaints of low desire. We'll talk about guys in a minute. Well, guys too, but let's do women first. So women with low desire, they're feeling very badly often about it. They are not necessarily, they often say they're in a very harmonious relationship. They feel horrible that they don't have desire, maybe since the baby was born, maybe since being on the birth control pill, maybe since being in menopause. There's all different reasons.
Mm-hmm.
So I found it so curious when I did my little deep dive literature search to find, Jeff will be smiling if he's listening, that there is evidence in the medical literature to really suggest that this can be highly effective for desire disorders, this meaning acupuncture. So tell me a little bit about, we can role play if you'd like, but how you would assess me coming to you for low desire, because to me, that's very much a mind thing, right? So how do you even know where to put the needles then? Do you put them in my head?
Well, there are ear points that go to the brain.
Okay.
I don't think it's ever just about the sexual organs.
Okay.
There's always other components. So I mean, it's not just blood flow. I mean, there are points on the lower abdomen that unite yin and yang and that connect with the genitals. Like I said, liver meridian stores hormones and does all that. So it's getting to know the person. Like, is it hormonal? Is it like a, medical condition, like something that you would treat, like, something that's causing pain? Is it birth trauma? When did it start? Like, that's a lot of times, and then with men, like one of the first questions is, do you have morning erections? So it's finding out exactly what that pivot piece is with the person, and then doing the points that are going to help them the most, that are going to relax them, that are going to bring in blood flow, that treat their points, that treat hormones, that are wonderful. But one of the things that's really important is I collaborate with a lot of practitioners. And so I need to assess, does somebody, have pelvic floor issues? Because I can do all the points I want, but if they're not getting that addressed, then it's not going to be successful. So I often send people for consultations to an OBGYN, or just for blood work, or to see somebody like you, or a urologist. I mean, it can be so many different things.
That's really good to hear, because I think another misconception about Eastern and Western medicine is that Western medicine practitioners don't refer to Eastern practitioners and vice versa.
Mm-hmm.
And I'm sure there are some people that stay in their lane, but the best possible outcome, I think you'd agree, is when we mix Eastern and Western.
Completely. Oh yeah. And a lot of people are surprised when they come to see me. They're like, oh, I'm on this antidepressant, or I'm using birth control. Don't be mad at me. I'm like, no, of course not. You should be doing that. And everything is collaborative, I think, because nothing's just that specific and isolated.
So let's go back to I'm going to be the patient now. So I'm going to come in and I'm going to say, ever since I went through menopause, I have low libido, I have low desire. I don't have desire to self-pleasure. I don't have desire to be intimate with my partner, even though I just love him to death. And I really need you to help me out. So will you tell me, number one, what to expect in terms of what you would talk to me about? Number two, exactly, and just, conjecture, I understand, but exactly where you'd put the needles on my body. And how long would you tell me, how many visits with you should I expect to see results?
Okay. All right. That's a lot. The last question is how many visit question.
Okay.
Nobody can answer that honestly.
Okay.
don't know. Everybody's so different. And personally, I don't see anybody more than 4 times if we're not getting somewhere.
Okay.
So I would start with your hormonal history. I would start with, what were you like as a little girl? When did you first, have entered puberty? And what have your periods been like? And you have children, and what were your births like? And what's menopause been like for you? So what I'm doing is I'm really teasing out what are the different, what medications are you on? Like
So it's the kind of history taking that we do in Western medicine, really.
It's really important because any one of those things could make all the difference.
Okay. So now tell me where my needles are going to go.
I would sort that out. Let's say that, okay. So let's say that you're in my office and you say, I ask about menopause, and you're like, well, I'm having night sweats constantly. I'm, having hot flashes. I'm much more anxious. I'm, having noticing changes in my urination. So that's going to tell me, let's think about bladder, kidney as a factor. So often what I do, most of us have a history, so I would start with doing like a nice clearing, like a clearing, balancing treatment on your back. And then I would work with that meridian in particular. So I would do points around your ankle. I would do a point, and I'm doing this based on, I'm determining that there is yin deficiency going on, or you wouldn't be having the hot flashes. So that's leading me to kidney. I'm not only going to treat one organ, but that's going to be around your ankle. There's a point about 3 inches on the shin, on the inside of the leg. That's really important for balancing hormones. I'm going to see if there was maybe a C-section or anything structural going on there. And I would do a needle 4 inches below the belly button. And then I would probably do maybe a point in the chest. I use a lot of needles. And I would also do the point in the center between the eyebrows that it's just for calming the mind. And then I would do some auriculotherapy and do a couple of ear needles for sexuality and calming the mind. So I would start there and do more like a menopause protocol.
I see.
Skewed that way.
Okay. So interestingly, that to your point, the other evidence base, or acupuncture just seems to shine in women's health, is menopause complaints like sleep disturbances and hot flashes, emotional lability and depression. Again, evidence-based to show that acupuncture is effective for many, many women who seek these specific complaints. And so even though acupuncture has been understudied, I think in a very rigorous fashion, the studies that have been done, there are themes after themes after themes. And luckily in research, there's been meta-analysis that put together like 24 studies and come up with generalized themes. And that's how I came up with the menopause situation. Low desire situation. It's pretty exciting to see that against Western stringent research protocols, acupuncture continues to show itself as effective. It's really exciting.
It is, because when I started 30-something years ago, people couldn't tell their Western practitioner that they were seeing me, because the practitioner, the doctor, would snicker and say, well, if you think it helps. And now so many of my referrals come from Western medical practitioners.
Yeah. You're not the little secret anymore. Now it's very wonderful to see what's happened.
It is. It's really.
Here's another misconception. Let's say a man comes to you with erectile dysfunction.
Yes.
Are you going to put a needle in his penis?
Only if he's a jerk. No, I'm
No.
sorry. No. No. There are, first of all, I want to know what's going on. I want to know if he's having morning erections.
Okay.
I want to know if he, masturbates. And has he, like, I had a man come to me who had this ever since his hernia surgery.
Mm-hmm. Mm-hmm.
Which is, I know, is rare. It's not, I mean, hernia surgery is usually a walk in the park, but it was due to that. And so we figured that out. He hadn't really made the connection. And so I worked with him. There were no needles in his penis. There is one point in the center of the perineum, which is, as you know, the part of the body between the genitals and the anus. And that's actually a very powerful point. I try not to use it too much because it's,
It's
usually, yeah, it is.
Yeah.
But sometimes that's really the point that does it.
Okay.
And again, points below, I worked on that hernia scar,
Mm-hmm.
points below the belly button, beefing up his hormones. And there's a point on the top of the head that really raises energy. It's like the most yang point, the most male point. And then I ended up actually sending him to, he was getting better, but not better enough. And I ended up sending him to a physical therapist who specializes in pelvic and pelvic floor, pelvic wellness. And she did the rest of it.
Okay. Well, that's pretty interesting.
Mm-hmm.
One of the things that kept coming up in my reading over and over again is that you can absolutely change and open circulation patterns. Can you tell me how that works?
I'm not sure exactly what you mean.
Okay, so it can improve, acupuncture can improve circulation to specific areas. How on earth does a needle in your ankle or whatever increase blood flow to a target tissue?
Mm-hmm. So I think of the meridians like, we'll think of a subway. So
Mm-hmm.
there's a train that goes to Brooklyn,
Mm-hmm.
and each of the points are a stop where you can access the specific function of that point along the meridian.
Okay.
So you're using different points along that channel. You're doing that point in the ankle, but you're also doing something that tells the body move energy up.
Okay.
And so you really like to direct things and not just stick a needle in and goes, well, this is going to help your blood flow. You want to tell the body how.
So is it like the meridian is the course of the train and the needles are at the stops of the train? Do I have that right?
Yeah. And when you get to the stop, which is the point, you can access particular function.
Okay.
So that water element, again, which often holds keys to sexuality and hormones, it also has to do with the emotion of overwhelm or anxiety.
Mm-hmm.
So I'd be looking for that. And then there are different aspects of that meridian with different points at those different stops.
Okay. Now I understand. At least
Yeah.
I'm starting to understand. Sometimes in sex therapy, we see couples together. We see a man and a woman, and we, or a man and a man, or a woman and a woman, depending on who's in the couple. Does that ever happen in acupuncture? I
treat a lot of couples, and I treat a lot of families.
Mm-hmm.
And that's really helpful. We don't have like side-by-side tables like a couples massage.
Okay.
But I do work with both, especially, I know we're going to talk about this after, but especially, with sexuality and also fertility.
Mm-hmm. Well, let's go ahead and launch into fertility, because the other thing, let me go to my evidence sheet here. So the evidence has been shown for both male and female infertility.
Yeah.
And a large part of it because it's such a it's so emotionally draining for people when they're not able to achieve a pregnancy and they really, really want it with all their hearts. Both partners, or if there's many partners, however many partners are in the union, they're suffering in their own way. So tell me a little bit about your approach to his and her when we look, or her and her, whatever, the couple, when we look at infertility, please.
Yeah. Well, the first thing is understanding what that does to people.
Mm-hmm.
I mean, the pain that, especially I think more, women go through, because they're the ones who are getting their period when they were hoping they were pregnant. And it's really heartbreaking. And so understanding that roller coaster that they go through, and then they have to open up and trust and get hopeful again when they've been really disappointed. So I definitely look at that. There's also a lot of excellent research on acupuncture and fertility, but most of the research I know of is IVF.
Mm-hmm.
There's this amazing book that you can't see it, but this book is all about, they say it increases IVF success 40 to 60%. And there's a lot of studies. I know. So
Okay.
people will just come for that. So I would first, so what I do if I'm treating somebody, let's say I'm treating a woman. So first I kind of try to do like a nice reset. There are meridians that go through the reproductive organs. And so I want to make sure that's all good. And I ask them questions, making sure that they've had their partner checked as well, because a lot of times people assume it's women. And so I ask a lot of questions again. And then there are points that actually there are protocols that can bring on a period to,
Mhm.
if you're going to do IUI, or you're going to do whatever you're going to do, or you just want your cycle regulated. So I need to find out how long their cycle is and
Mhm.
when they should come in, so I can do hormonal treatments, again, getting a lot of blood flow there. But also really dealing with the emotions. And there are protocols I do for the first half of the cycle that I would never do in the second half. So in the second half of the cycle, I assume that every woman I'm seeing in her second half, if she's having sex, I'm going to assume she's pregnant.
Okay.
So are points they're called forbidden points. And there's information about which points can be not safe in every different month, every different aspect of pregnancy. So I'm going to assume that second half of the month, we are doing treatments that hold things up.
Uh-huh.
There's a point, it's called the happy baby point, or the beautiful baby point.
Okay.
And that also is on the inside of the leg.
Mm-hmm.
People say that's the one point that always works, because every mother thinks her baby's beautiful. So I would do that.
Mm-hmm.
I would basically do like a miscarriage prevention, just
Okay.
sending as much blood and chi as we can get to the womb, nourishing, amniotic potential, like whatever there is to nourish and hold up.
Okay.
So I do that the second half, and then hopefully we're good. And if we're not, then we go to clearing, resetting. If somebody is doing some kind of medical intervention, there's incredible protocols for like really stimulating the ovaries before an egg retrieval that we want to do. So I totally want to do that before the second half, before ovulation on any woman who's trying to get pregnant. Like we want, and those points, it's about three to four fingers breath under the belly button.
Okay.
And then, so there's a couple points there that are really excellent. And then you go out a few inches and there's a point for the ovaries. There's also a point called from the Chinese translation. It's the womb heart correspondence.
Okay.
I love doing that point. That point's on the back, and it's really acknowledging the connection between the womb and the heart.
That's lovely.
Yeah.
What about if a guy has low sperm count? Let's go to men, and let's say they have either poor motility, low sperm count, and it is a male factor, or at least or a shared factor infertility situation. Let's talk about male treatment for a minute.
Yes. So going back to our yin and yang, that is, I interpret that as we want more yang, more male energy that brings things up, and less female energy that brings things less yin. In a woman, we want her juicy and moist and yin. If it's a man, we want them hard and held up.
Right? Or yawn, I guess, right?
Yang.
Okay.
So I would be doing, again, some general hormone points. I would be doing lift things up and really seeing how is that yang deficiency showing up in other ways too?
Such as?
I can look at. Such as maybe secondary sexual traits that I might observe that might make me do a little more something than something else. Yeah, I look at things like that. And I also, there's so much compassion for them. There's so much pressure. And
every month, I know.
Awful. And we talked about before, talk about libido. Like sex used to be, hey, let's fool around. And now it's like, hey, this window's open and you better bring the goods. And
that's a lot of pressure. It really is.
A lot. And guilt and, so that's really complicated. And so I definitely work with that also. I might not talk about that so much.
Got it.
I will treat that.
That's fantastic. And I can't believe the stats for IVF. That's supporting IVF is just amazing. That's just wonderful.
There's really good research on that. And sometimes what people will do, they'll even call people who are not patients will call and say, I know about this. And so there's a protocol that they're both very different for right before implantation and right after.
Yes.
And there are fertility centers that actually have acupuncture there. And that would be one of the instances where I would do more of a straight protocol, researched protocol, and less personalized, like we know what we want here.
Right.
This is about this working.
So acupuncture does have, you bring up a really good point. There are published protocols for where to put the needles.
There are.
Or guides or recipes for where to put the needles to accomplish XYZ when the complaint is ABC. Am I correct?
Right. There is.
There's quite a bit of science involved in this. It's not just, a little of this and a little of that.
No, there are research studies.
Okay.
And I've found that especially with cancer treatments. So
go ahead.
We're not going to reinvent the wheel here. So when there are really good studies done with protocols for specific situations that are not about customizing something, I'm going to do those protocols, but then I'm going to mix in other things to enhance that and tailor it to the person's specific situation.
So let's launch into that. One of the things on your CV and one of the things you're known for in our area, we're in the Philadelphia area, is how very, very compassionate and how excellent you are supporting patients who are undergoing diagnosis of cancer, treatment of cancer, and then the sequelae of cancer, surgery, etc. Can you speak to that a little bit, please, specifically as it relates to cancers that affect sex, which is all of them, by the way, but
all of them.
Notably reproductive cancers and breasts and things like that. So
exactly. So, boy, where do I start? And like you said, it starts with often waiting for tests to
Yep.
come back
Yep.
and dealing with a diagnosis. Um, Again, everybody reacts to that so differently. Like there are people who are really worried, and there are people who are angry. How could this happen to me? And there are people who are frightened, and there are people who are just going to fight, or people who are like, no bad days. And so you're not going to treat each of these people exactly the same.
Mm-hmm.
I'm going to take those studies. Sloan Kettering did all these studies. Why wouldn't I? We should be using that information.
Mm-hmm.
But then the rest of the treatment, I'm going to be harmonizing those other issues. And I think cancer is an issue. I mean, when somebody's waking up in menopause and they're 32,
Right.
that's a big deal. And to
Mm-hmm.
think that they're going to, go home and be really sexual right away is not the case. And I do feel like that takes a team
Mm-hmm.
that is going to be using the protocols that have been researched from MD Anderson, where I also studied. I'm going to use those, but I'm going to refer them to somebody like you who has other tools, like for lubrication, for achieving orgasm, but their sexuality might not be the same as before they had this.
Mm-hmm.
They're going to have to find, and a lot of partners don't know what to do when their partner has had, surgery or treatments that affect, their sexual relationship. And the intimacy is so important then.
Mm-hmm.
And everybody's affected differently. Like I have, women who come in who've had all this hormonal therapy and surgery, and they don't have vaginal dryness. So it's not all the same.
Right.
But I think learning new ways to express your sexuality. I'm a big fan of vibrators and things like that.
Mm-hmm.
But there's also, I don't know. I don't have the knowledge for what kind of supplement might be really helpful and
Mm-hmm.
what kind of lube does not have any estrogenic
Mm-hmm.
properties. So
Mm-hmm.
somebody, I would be like, oh my God, you got to go see Susan Kellogg.
Mm-hmm. I understand. Thank you. So back to cancer just for a minute. Sometimes the downstream effect of cancer is sexual pain. Very often it is, whether it's dryness or whether it's a change in the pelvic floor, there's stitches there. Let's not forget prostate cancer. Please, let's not forget prostate cancer. So if you're following a protocol, let's say you're following an MD Anderson protocol, does it have in the protocol, do this many treatments for this many days and expect this result? Is it that tight? Is it that prescribed?
It's that prescribed. Is it going to go that way? It is that prescribed, but that doesn't, everybody reacts so differently to treatments. Like I said, and, with prostate cancer treatments, people who, I notice, or it seems to me like they're treating prostate cancer much less aggressively right now.
Mm-hmm.
Like they used to be way faster to do that surgery.
Mm-hmm.
And so I would have men come in who are incontinent.
Mm-hmm. Exactly. After post-surgical, right?
Post-surgical incontinence.
Yeah.
And so I'd be working to help with that.
Yeah.
And I would be using specific protocols, but you don't know how long, everybody's response is different. I treat people who hop off the table and say, I feel like $1 million. And then some people, like a couple days later, they notice it. But, and so with prostate cancer, I would use that perineum point for sure.
You would. Okay.
I would be working with that. Acupuncture is wonderful for doing scar work.
Okay.
We really believe in that there's obstruction of blood flow.
Yes.
There's an interruption in the meridian with that, but not everybody forms scar tissue the same way.
Mm-hmm.
So that's going to be very personalized, but really working with that scar and, helping that not be painful and kind of getting them back in their bodies after a trauma.
Yeah. Speaking of trauma, let's just jump right into when the complaint is not, I'm going to put this in air quotes, physical. There has been a history of childhood sexual abuse, adult sexual abuse, birth trauma, trauma. And so the patient says nothing on me hurts, but I'm numb. I'm traumatized.
I know.
What meridian is that?
Okay. That is back to pericardium, circulation, sex, because that is about emotional safety.
Mm-hmm.
It's about trust. When there has been trauma, that's often about a betrayal of trust, a betrayal of intimacy.
Mm-hmm.
And there's actually a point, I don't want to scare people, but there's a point on that meridian that's about an inch away from the nipple. And they say you can only treat it on men, but that's not true.
Okay.
I'm very comfortable doing that. And that's all about betrayal of intimacy. There's also a point in between the head of the bicep that's very much about that. And trauma is often when I will ask somebody, do you have somebody that you're really comfortable talking to? We might want someone else on our team.
Uh-huh.
And I make a referral to a therapist, to a trauma-informed therapist, because acupuncture deals with emotions, but I'm not an amateur therapist.
Mm-hmm.
And I don't process emotion with people. Mm-hmm. I mean, I can identify them and I can lead them. Like I have two practitioners who really work, especially with, they're sex therapists. That's their thing. And so that would be wonderful. Or I have about 5 different therapists that I refer to.
Okay. So let me ask you, in Chinese medicine, is trauma seen as something that also interrupts a meridian flow?
Oh, yeah. It's a betrayal of intimacy.
Okay.
It's a betrayal of trust. I mean, you can see people's, bodies. A lot of people have like forward shoulders and maybe they have nightmares and there's a big interruption. And so really working with helping somebody come back into their body and feel safe, like even just having them on the table, being really relaxed and feeling so comfortable. I'll say to them, like, I'm going to leave the room for 10 minutes and this is your time to just be in your body, and it feels good, feels okay. And so reintroducing, because a lot of times when there's trauma like that, there's dissociation.
Mm-hmm. I understand. So are people naked when they get acupuncture?
Pardon?
Are people naked when they get acupuncture?
No. Some practitioners have people fully clothed and they only do points from elbows and knees down.
Okay.
I have people in underwear or like a sports bra and shorts or whatever, and I have sheets, a bottom sheet and a top sheet, and I'm really careful to drape people in a way that they feel comfortable.
Okay.
And some people like want to hop up there naked and say, hey, I'm commando today. And I have people who like have a little acupuncture suit that they bring with them that they put on. And both of those, are fine.
That's wonderful. All right. So one more thing we have time for, and that's just musculoskeletal pain. Holy moly. You've made some reference to pelvic floor dysfunction, which is thought to affect 25 to 30% of men and women. Can affect people through the lifespan. It can affect bladder. We'll talk about bladder a little bit. Bladder function. It can affect sexual function, defecatory function. Now, I don't think besides the perineum, you're going in the vagina and putting needles in the vagina or up the anus. Am I correct?
I do not do that.
Okay, all right. So in light of the fact that you don't do that, where would like needles be to help a musculoskeletal injury? Must it be in the muscle that is problematic, or I have to stop thinking like that and think meridian?
Well, yes. So are you're talking about, if we're going back to sexuality, you're talking about, like, let's say we're talking about birth trauma or something.
Sure, absolutely. Yep.
So an injury that happened during childbirth.
Yep.
So what that would be, I do local work. So I would be doing some local things. I'm really careful who I would do that perineum point. I mean, honestly, I probably do that 6 times a year.
Okay.
Because if somebody's in pain and they don't feel good about that, they don't need a needle stuck down there.
Okay.
But the meridians go all over. And there's also correspondences in this medicine. So like, if somebody has a knee injury, you could also treat their elbow.
Truly. Yeah.
Oh, yeah.
Okay.
And Japanese or Taiwanese acupuncture think it's barbaric to go to the source. They say it's spanking a crying baby. And so if it's your hip, they would needle your shoulder.
I understand.
That's ridiculous. If their hip hurts,
stay away from it, right?
What's the matter with you? So I do a lot of educating about pelvic floor therapy. People don't know anything about that, and it's really important. Some of us do cupping, or also something called gua sha, which is like a scraping medicine with oil, and that kinds of body work can be really effective also as an adjunct. So let's say, I might cup somebody's low back and glutes, as well as work on the front of them.
Okay.
For that injury.
We're getting close on time, so I want to ask a few more questions.
Okay.
Number one, are all acupuncturists the same? Are they all trained exactly the same? Are they all certified? Are they all cash only, insurance only? So try to give me a landscape of what we're looking at. And most importantly, how can our listeners find an acupuncturist in their area?
Yeah. We are so different. We have to all be so different. There are so many different schools of thought. I mean, this is probably 8 to 10 countries over 4,000 years of medicine. Like you might go to a school that specializes in Japanese acupuncture, or you might go somewhere. I mean, there are so many different kinds. And so it's really important to find your good fit. Okay. There's goodness of fit. It's all about, it's like everything else. A lot of this is about relationship. And if you're not comfortable with the person, like if you go for acupuncture and you're like, I just didn't like the setup, I didn't like the person, then go find somebody else. Because we are extremely different and we have a lot of continuing ed requirements. So we specialize in different things. So when somebody's looking for an acupuncturist, a lot of people will call me and I'll try to find them somebody in another state. But I tend to look at I recommend that people look at websites, and you want somebody, like if you're going for sexual function, you want somebody who's going to be more about internal medicine than somebody who's really like all their credentials are about sports medicine. Or so you really want to see what people's specialties are. We're different in what, so one of the things you want to find out when you call somebody to make sure that give it the best shot of having a good fit, you want to look at their training, see what they specialize in.
Mhm.
I would call them. I mean, people call and talk to me. If an acupuncturist won't talk to you because they're too busy, that says something.
Mhm.
Or if they have an assistant who's maybe really well informed and will speak to you so you
Mhm.
can learn a lot about their practice. One of the big differences is, do we do body work or not? One of the really big differences that we did not get into is herbalists, Chinese herbal medicine. And that is a whole other thing. In the US, a lot of acupuncturists practice herbal medicine. In Asia, there's herbalists, there's acupuncturists. So they are very different.
Mhm.
And the Western medical community feels very differently about herbalists and acupuncturists. And there are some things that I think herbal medicine's great for.
Mhm.
And that I've told people you should probably see somebody, like if somebody has like a giant fibroid or something. I mean, at a certain size, it's gotta be surgical. But like certain conditions, you want somebody who does herbs too.
Okay.
And if they're an herbalist, if you look at their site and they're an herbalist, they're probably going to want to do herbs. So you want to check that out with your comfort level. And you want to ask, first of all, I mean, we have to be licensed and certified. I mean, otherwise, who's sticking a needle in you? That would be crazy. You want to find out how long they've been practicing. I would say, at least 5 years is a start. Do they do body work? Do they, because that's important. And maybe that's something you don't want. Like people come to me, they don't want me cupping them. So I would never do it, but it's an option.
Right.
And then the big question is, how many people do you see an hour?
Okay.
And if somebody says 4, okay, then you know that. And if somebody says, I see 1 person an hour, that's a very different experience. And insurance, I mean, more and more people are taking insurance, but that is based on a different model. A lot of times it's more of a clinic. There are a few people being seen. It's also way more affordable.
Right.
But it's not the same experience as somebody spending an hour focused on you.
Understood.
So you want to.
That's all right. This has been amazingly illuminating, and I hope we answered some of the questions. I know I got my questions answered. I had so many questions answered about this. And if you haven't had the experience of acupuncture, for those that are listening, it doesn't hurt, and it is really pretty exciting. You do feel like $1 million. So anyway, I'm going to say goodbye for us, but I'm going to go back to Vic and say, hey, Vic, what's going on?
In this episode, we chat with men's health expert Dr. Martin Miner about the link between health and sexual wellness. Dr. Miner, an expert on male hormonal health, explains how low testosterone, diabetes, and heart disease affect sexual performance and intimacy. We will break down the myths, talk about evidence-based treatments, and highlight the importance of proactive, whole-person care for men. This episode offers vital health insights for men and partners with compassion and clarity. Take control of your health today. Watch us September 2nd at 7 p.m.
Pretty exciting. All that testosterone and lifting. Alrighty. So I want to say thank you to all of the listeners tonight. And thank you most especially to Dory Ellen Fish, the expert acupuncturist that has just illuminated our world a little bit. And how does acupuncture fit into sex med? Just perfectly, if you ask me. So say goodnight to everybody. Thank you for your attention. Please watch us on all of the video streaming platforms and on the air. And we'll say a fond good night. And I think Jeff's going to say good night too.
If you have ever been on the podcast before, you know I couldn't leave you without a closing, centering, earthing exercise. I mean, especially when I'm doing some major earthing in the majestic Canadian Rockies while this podcast is being broadcast live. As we end this beautiful conversation, let's take a moment to pause and reconnect with ourselves. Wherever you are, sit or lie down in a way that feels comfortable and supported. Close your eyes and begin to bring your attention to your breath. Breathing is so powerful. Take a slow inhale through your nose, allowing your belly to rise and your lungs to fill completely. Hold it gently and then exhale slowly and fully through your mouth, letting go of any tension you're holding. Continue that breathing pattern. Deep breath in from the abdomen. Fill those lungs through your nose. Slowly exhale out of your mouth. And as you continue that breathing pattern, imagine a gentle wave of warmth flowing from crown of your head down your spine and into your pelvis. This is your center, your place of strength, healing, and wisdom. With each breath, feel that energy softening and nourishing the parts of you that need care. Continue that deep breathing pattern in your nose and out your mouth as you recognize these truths. I am worthy of wellness. I am capable of healing. I am deeply connected to my body and the world around me. I am enough. Take one final breath in and exhale with gratitude for showing up for yourself today. Carry these truths forward with you into your life. Thank you.